Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hello, I'm Dr. Warren, and today we want to run through stages of Lyme disease, and I get a lot of questions about how fast you run through the different stages, so let's just try to plow through. A lot of this has to do with how fast does it become chronic and how quick do you have to get antibiotics on the front side. So let's dive in. I'll try to answer all those questions. A brief overview: Lyme disease is Borrelia. The most common kind is Borrelia burgdorferi, but there are 18 other species that we test for. So if you have Borrelia mayoni, you still need to test for that. Not just burgdorferi, they're also not regional, so you got to test for all of them if you are mysteriously sick. It is transmitted through a tick bite, and it is mainly deer ticks, but you can get it from other ticks. People ask me, can you get it from other insects? We have not sufficiently studied that, so we should study that. That's my answer. We should go study that. It is important to get a timely diagnosis because the first stage is early or local Lyme disease, and this usually lasts about a month. We think about this as a 30-day window in the early stage. It usually develops within a couple days to maybe a week or two after the tick bite. So this is you're off camping or you're off outside, you get exposed to a tick, maybe you're gardening, maybe you're in a field, maybe you're hiking. For me, I'm mountain biking. I had 4 ticks on me this last summer. So if you're going outside, you're in woody areas, you're in grassy areas, you're anywhere where there's deer, there can be deer ticks. That's the way it goes. So within about a month of being sick, you have this early where it's local. Sometimes you get a rash. It's really easy if you get this bullseye erythromigrans type rash, because that's the dead giveaway. It's Lyme. If you have that, it's Lyme. It's nothing else. And we need to just assume it's Lyme. Now, in this early phase, you can get testing done, but it's hard to catch it. It takes your body 3 to 7 days to make immunoglobulin M's against it, and it can take 3 to 4 weeks to make immunoglobulin G's against it. So in this phase, you might find IgMs, but also you might just have to go based on symptoms and history of exposure to know your illness is coming from Lyme. The nickname for Lyme is also the summer flu. So if it looks like that rash, or if it's kind of a fever, chill, headache, achy, flu-y type thing, then consider it highly possible for Lyme. Somewhere between 30 and 60 days, it starts to transition to what we call stage 2, or early disseminated Lyme disease. So in the first part of this, we know that antibiotics, if you get doxycycline, it is 80 to 90% effective in this opening stage 1. Now, there was a study done at Tulane where they took mice, gave them Lyme disease, and waited 60 days to give them the antibiotics instead of 30. And by 60 days, the Lyme has become much more resistant. So somewhere between 30 and 60 days, the Lyme's becoming more resistant, and it's getting into that disseminated Lyme disease stage. Now, the disseminated part means we start to get more widespread symptoms. So usually weeks to a couple months after, we start getting the bacteria spreading through your whole body. So one of the key things you're looking for to see if it's spreading through your body is if you are getting rashes all over. So you're not just getting the rash right where you got the bite, maybe you have 2 or 3 rashes in different places. That would tell you the idea that it's starting to be disseminated or spread throughout more of your body. You also can get, at this phase, we can start to get neurological issues. Lyme's favorite tissues are nerves and joints, so then we can start to get joint swelling and aches and pains in other places of the body. And then it can cause cardiovascular complications also. So if we get heart palpitations or dizziness or lightheartedness, then we know it can hit the cardiovascular system. So what you're looking for is maybe weird neurological problems, weird joint problems, and or weird cardiovascular symptoms. Those are all places that Lyme likes to cause problems and would tell you it's becoming more widespread throughout your body. Now, the length of this stage is, like I said, somewhere after 30 days. And then usually people cut this off at 2, 3, 4 months. There is no consensus exactly on when this stage really ends. But at a certain point, we get into stage 3, which is late or disseminated Lyme disease. And this is where it can go on just in perpetuity. So now the Lyme has become chronic. If we study this, we know it's switched from the active form to a biofilm or a stationary form, also called a round body. I do not like the word inactive. It is less active, but it is not inactive, so let's not spread that. But you can get chronic arthritis, chronic neuropathy, so you end up in rheumatology's office and they're confused, you end up in neurology offices and they're confused. We know you get fatigue, you get cognitive impairment, we have trouble sleeping, we have trouble thinking, we have trouble with words. And so if you're having any of these ongoing symptoms, especially if you've had a history of tick exposure or living in tick endemic areas, which is again, anywhere there is deer, I promise there's deer ticks. All right, what does late stage Lyme disease look like? We talked about that. Persistent inflammation, joint pain, swelling, nerve symptoms are a big deal. May overlap with other chronic conditions. So this is where sometimes it takes a couple doctors to try to figure out this is really coming from Lyme, and we have other articles about how your doctors miss it. So the neurologist miss it, the rheumatologist misses it, the GP's missing it, the infectious disease miss it because they're running tests from 30 years old, have to run multiple species of Lyme, have to run multiple species of co-infections. We have other articles, I talk about that. Is there a stage 4? That's a good question. There's a new term for chronic Lyme. It is called post-treatment Lyme disease syndrome, or PTLDS. I'm not a fan of the new name. I'm not a fan of a more complicated acronym, but it is the new term being used. Some people are calling stage 3, which is late disseminated Lyme, the PTLDS, or some people are calling now the PTLDS stage 4. And the argument really has to do with, do you have to do more killing of the bug or do you not have to do more killing of the bug? We will talk about that in other articles, but that's a fierce fight going on right now in the Lyme disease world. Can you fully recover from Lyme disease? I am here to absolutely tell you the answer is yes. In our experience, my wife was sick for a number of years, 7. She's now been healthy for about 9. We're very thankful for that. And I've had the privilege in my clinic to see other people go from being sick to being well. We have some testimonials all around on our website and YouTube channel of other people who have gotten well, because I got this question so much. We wanted to share other people's stories from their perspective about them getting well. So a couple key points. One, we do know that the antibiotics are very effective in the early stage. So if you know you are sick and were recently exposed to ticks, getting antibiotics in the first month is always recommended because that's when they're the most effective. Now, late stage, probably going to require longer. Once you're 60 days in, this 2 to 4 week antibiotic course does not work that simply. You either need more antibiotics or we need to start doing a more holistic approach like what we do. And definitely by the time it is full blown in that post-treatment phase or in that late disseminated phase, a comprehensive approach is going to be better. We need immune system support. We need to rebuild the broken parts of your body, and we need to be able to attack the Lyme, not in the active form, because it's not in that form really anymore. It's in those biofilms and in those stationary forms. And this is where we believe the research shows that the herbs and the natural route actually is the best way, in our experience, to get chronic, long-term Lyme people healing and living their life again. I hope that this helps you understand the different Lyme disease stages as it moves. That first month is probably the early stage. Month 2, maybe up to month about 4 is kind of that early disseminated stage. And then for sure by about 4 months in, you are in that late disseminated stage, and that can just go on in perpetuity for years. We think the functional medicine and functional health approach really supports a long-term healing and wellness. No matter how long you've had it, you can get better. I've had people who've had it for decades who have gotten better, had people who've had it for a year who've gotten better. So once you're past, to me, about that 4, maybe 6 month mark, depending, once again, you're gonna get a little bit of argument on that. It's in the chronic long-term phase, and you just need kind of a chronic post-treatment Lyme disease type support protocol in order to heal and return your body to health. I'm Dr. Warren. If you want to learn more about Lyme disease and our method to trying to help you heal from Lyme disease, click on the link below and learn more about how we help people recover from chronic Lyme disease or post-treatment Lyme disease syndrome.